Did you know that over 50 million people worldwide take amlodipine every single day? But here's what's truly shocking: thousands of these people are walking around completely unaware of 7 deadly side effects that could strike without warning. If you're taking amlodipine or know someone who is, the next 10 minutes could literally save a life. Some of these side effects are so dangerous that ignoring them could land you in the emergency room within hours. Amlodipine is one of the most prescribed blood pressure medications on the planet. Doctors hand it out like candy because it's incredibly effective at lowering high blood pressure and treating chest pain. Millions of people rely on this little pill every day to keep their hearts healthy and their blood pressure in check. But here's what your doctor might not have fully explained: while amlodipine can save your life, it can also put you in serious danger if you don't know what warning signs to watch for. Today, we're going to expose 7 side effects that are so severe, they require immediate medical attention. By the end of this video, you'll know exactly what symptoms to never ignore and when to call 911. This information isn't meant to scare you, but to arm you with knowledge that could prevent a medical emergency. 1. Severe heart problems. Picture this: you've been taking amlodipine faithfully every morning for months, thinking you're protecting your heart. Then suddenly, you start experiencing chest pain that's worse than anything you've felt before. This isn't just discomfort, this is your heart crying out for help. Here's what's terrifying about this side effect. Amlodipine can actually worsen angina and trigger heart attacks in certain people with severe heart disease. The medication that's supposed to protect your heart could be the very thing that puts it in danger. You might notice your heartbeat becoming irregular, pounding so hard you can hear it in your ears. Some people describe it as feeling like their heart is trying to jump out of their chest. The chest pain can start as a dull ache and quickly escalate to crushing pressure that spreads to your arms, jaw, or back. What makes this even more dangerous is that many people dismiss these symptoms, thinking they're just having a bad day or feeling stressed. But when amlodipine triggers heart problems, every second counts. If you experience chest pain that doesn't go away after a few minutes, especially if it's new or worse than usual, don't wait, call 911 immediately. The same goes for faster or irregular heartbeat that comes with nausea, sweating, or trouble breathing. Remember, paramedics can start life-saving treatment before you even reach the hospital. Don't drive yourself to the emergency room, you could pass out behind the wheel. 2. Dangerous blood pressure drops. Imagine standing up from your favorite chair and suddenly feeling like the world is spinning out of control. Your vision goes black, your legs give out, and the next thing you know, you're on the floor with a splitting headache. This is exactly what happened to thousands of amlodipine users who experienced dangerous drops in blood pressure. The drug that's supposed to gently lower your blood pressure can sometimes slam on the brakes too hard, sending your numbers plummeting to life-threatening levels. What makes this side effect so treacherous is how quickly it can strike without warning. One moment you're perfectly fine, the next you're unconscious on the bathroom floor. The dizziness isn't just a mild inconvenience, it's your brain screaming that it's not getting enough blood. Falls from fainting can cause broken bones, head injuries, or worse. Elderly patients are especially vulnerable because their bones are more fragile and their recovery is slower. The risk becomes even higher if you exercise in hot weather, drink alcohol, or take other medications that lower blood pressure. Dehydration can turn this side effect deadly. Heavy sweating causes you to lose too much water, making your blood pressure drop even further. Here's what you need to watch for: feeling dizzy or lightheaded when you stand up, especially if it's getting worse over time. If you actually faint, that's a medical emergency. Even if you feel fine afterward, your blood pressure might be dangerously low. Call your doctor immediately if you experience repeated dizzy spells or if you faint even once. Don't ignore these warning signs, they're your body's way of telling you something is seriously wrong. 3.
Liver damage. Sarah was a healthy 58-year-old teacher who had been taking amlodipine for just 3 months when her husband noticed something alarming. Her eyes had turned yellow, and her skin had taken on a strange, jaundiced appearance. Within days, she was rushed to the hospital with severe liver damage. This is the horrifying reality of amlodipine-induced liver problems. They can develop silently and strike with devastating speed. Your liver is working overtime to process this medication, and sometimes it simply can't handle the load. The scary part is that liver damage often starts with symptoms that seem completely unrelated to your heart medication. You might notice your urine becoming dark brown, almost like cola. Your stools might turn pale or clay-colored. These aren't just cosmetic changes, they're your liver sending out desperate distress signals. The yellowing of your skin and eyes happens because your damaged liver can't properly process bilirubin, causing it to build up in your bloodstream. But the visual symptoms are just the beginning. You might experience severe pain in your upper stomach that feels like someone is stabbing you with a knife. Nausea and vomiting can become so intense that you can't keep anything down. Some people describe feeling like they have the worst flu of their lives, combined with abdominal agony. What's truly terrifying is how quickly liver damage can progress. In some cases, patients go from feeling perfectly fine to needing emergency treatment within just a few weeks. The liver doesn't have pain receptors, so by the time you feel stomach pain, the damage might already be severe. If you notice any yellowing of your skin or eyes, dark urine, pale stools, or severe stomach pain, stop taking amlodipine and get to an emergency room immediately. Liver damage can be reversed if caught early, but waiting too long could be fatal. 4. Severe swelling, edema. Meet Robert, a 65-year-old construction worker who loved his daily walks with his wife. After starting amlodipine, he noticed his ankles getting a bit puffy. Just getting old, he thought, and ignored it. 3 months later, he couldn't fit into his shoes, his legs looked like tree trunks, and he was gasping for breath just climbing one flight of stairs. Robert was experiencing severe edema, and it was slowly killing him. Here's what's happening inside your body. Amlodipine relaxes your blood vessels, but sometimes it relaxes them too much. This causes fluid to leak out of your blood vessels and collect in your tissues, especially in your legs and feet. What starts as minor ankle swelling can rapidly progress to massive fluid retention that puts your heart under enormous strain. The swelling isn't just uncomfortable, it's a sign that your cardiovascular system is struggling to cope. When fluid builds up in your lungs, it becomes a medical emergency. You might find yourself waking up in the middle of the night gasping for air, feeling like you're drowning from the inside. This is called pulmonary edema, and it can kill you. Women are particularly susceptible to this side effect, experiencing swelling nearly 3 times more often than men. The 10 mg dose carries the highest risk, but even lower doses can cause problems. Here's how to recognize when swelling becomes dangerous. If you can press your finger into your swollen ankle and it leaves an indentation that doesn't bounce back immediately, that's concerning. If the swelling moves up your legs toward your knees or thighs, that's even worse. But the most dangerous sign is when swelling combines with shortness of breath, especially when lying down. If you're propping yourself up with extra pillows to breathe at night, or if you're getting winded from activities that used to be easy, your heart might be failing. Don't wait for it to get worse, call your doctor immediately. 5. Serious allergic reactions. Linda had taken her first amlodipine pill on a Tuesday morning. By Tuesday evening, she was fighting for her life in an intensive care unit. Her throat had swollen shut, her entire body was covered in angry welts, and her blood pressure had crashed to dangerously low levels. Linda was experiencing anaphylaxis, the most terrifying allergic reaction your body can have. What makes drug-induced anaphylaxis so deadly is how fast it strikes and how quickly it can kill. Your immune system goes haywire, treating amlodipine like a lethal invader. It launches an all-out attack that ends up destroying your own body instead. The reaction can start within minutes of taking the pill, or it might not appear until you've been on the medication for weeks. You never know when your immune system might decide that amlodipine is the enemy. The first sign is often a feeling that something is terribly wrong. Your lips, tongue, or throat start tingling and then begin to swell. This isn't just mild puffiness, we're talking about massive swelling that can completely block your airway. You might notice your voice becoming hoarse or raspy as your vocal cords swell. Breathing becomes a struggle, then a desperate fight for survival. Your skin breaks out in huge, raised welts called hives that itch and burn. Your face might swell so much that you're unrecognizable. But here's the most dangerous part. Your blood pressure can plummet so fast that you lose consciousness within minutes. Your heart starts racing, trying desperately to pump blood through your collapsing circulatory system. If you experience any swelling of your face, lips, tongue, or throat after taking amlodipine, don't wait to see if it gets better. Call 911 immediately. Tell them you're having an allergic reaction to medication. If you become dizzy, confused, or start struggling to breathe, you're in a life-threatening emergency. EpiPens can buy you time, but you still need emergency medical treatment. Anaphylaxis can be fatal within 30 minutes, so every second counts. 6. Pancreas inflammation. Tom was enjoying dinner with his family when it hit him like a freight train. A pain in his stomach so excruciating that he doubled over and couldn't speak. His wife rushed him to the emergency room, where doctors discovered his pancreas was severely inflamed. Tom had no idea that his daily amlodipine pill could trigger pancreatitis, a condition that kills thousands of people every year. Your pancreas is a small organ that plays a huge role in your digestion and blood sugar control. When amlodipine triggers inflammation in this delicate organ, the results can be catastrophic. The pancreas starts digesting itself, releasing powerful enzymes that eat away at the surrounding tissue. The pain is unlike anything most people have ever experienced. It's been described as worse than childbirth, worse than kidney stones, worse than a heart attack. The agony typically starts in your upper abdomen, right below your ribcage, and can radiate straight through to your back like a red-hot poker. Moving doesn't help, lying down doesn't help, and pain medication barely touches it. You might find yourself curled up in a ball, rocking back and forth, desperate for relief that doesn't come. Along with the crushing pain comes violent nausea and vomiting that can last for hours. You can't keep food down, you can't keep liquids down, and you quickly become dehydrated and weak. What makes amlodipine-induced pancreatitis so dangerous is how rapidly it can progress from uncomfortable to life-threatening. Your pancreas can become so inflamed that it starts affecting other organs. Your blood pressure might drop, your kidneys might fail, and you could go into shock. People with diabetes, gallstones, or who drink alcohol regularly are at higher risk, but pancreatitis can strike anyone taking amlodipine. If you experience severe abdominal pain that comes on suddenly, especially if it's accompanied by nausea and vomiting, don't wait to see if it gets better. This isn't food poisoning or a stomach bug. This could be your pancreas crying out for help. Get to an emergency room immediately. Pancreatitis caught early can be treated, but if you wait too long, it can be fatal.